Good afternoon, everyone. Welcome and thank you for joining us today for the webinar on the Notice of Special Interest for Research on Oral Anticancer Agents in the Context of Utilization, Adherence, and Healthcare Delivery. My name is Bryce Geiling, and I'll be your WebEx host. Before we get started, I'd like to make a few comments. All lines have been muted upon entry and will remain muted for the duration of the webinar. You can submit your questions throughout the presentation in the chat panel and select host from the drop-down. The moderator will ask them on your behalf during the Q&A portion of the webinar. If you need to view live captioning, please refer to the link that will appear in the chat panel. And lastly, please note that this webinar is being recorded. And now I'd like to turn it over to Dr. Wendy Nelson.
Good afternoon, everyone, and thank you for joining our webinar on oral anti-cancer agent utilization, adherence, and healthcare delivery. I'm Wendy Nelson, and I'll be presenting the first part of our webinar. This Notice of Special Interest, or NOSI, is an extension of our program announcement on the same topic. This NOSI will be active a week from today and will be available for 3 years. Next slide. Today, I'll be joined by my colleagues and co-authors of this NOSI, Kay Castro and Kelly Filipski. Next slide. The three of us are program directors in different research programs in the Division of Cancer Control and Population Sciences. Kay Castro is in the Healthcare Delivery Research Program, and her focus is on improving safe and effective delivery of oral therapies. I'm in the Behavioral Research Program, and my focus is on adherence to oral agents. And Kelly Filipski is in the Epidemiology and Genomics Research Program, and she focuses on the patient and provider factors that influence utilization of oral anti-cancer agents. And I should point out that our main interest is molecularly targeted oral therapy. Next slide. In the next few minutes, I'll provide some background on why we developed this initiative on oral anti-cancer agents, discuss features of the NOSI, and review the funding opportunity announcements associated with the NOSI. We'll leave time at the end for your questions. However, we will not address questions about your specific aims or application details. If you do have questions specific to your current application, we encourage you to contact us, and we'll provide our contact information at the end of this webinar. Next slide. Now I'm going to present a little bit of background on molecularly targeted oral anti-cancer agents. Next slide. As you know, these medications have transformed cancer care. While oral therapy offers many advantages over intravenous chemotherapy, at the same time, there are a number of potential disadvantages. So while patients can now avoid multiple trips to the hospital or clinic, at the same time, they may need to manage complex treatment regimens on their own, and this may be particularly challenging for patients with chronic health conditions who take multiple medications. In addition, patients taking oral medication are responsible for managing side effects of these drugs and knowing when to seek medical attention. And finally, there is the financial burden of these very expensive molecularly targeted drugs. Next slide. Next slide. So why do we need this NOSI? Because we still have a lot to learn about how these drugs are being used, why adherence is so poor, and how we can safely deliver these drugs. For example, with respect to utilization, we need to learn if these targeted oral agents are being prescribed appropriately and if they're being used off-label. With respect to adherence, we need to understand why patients have difficulty taking these drugs as directed, especially since suboptimal adherence can lead to therapeutic failure. As for healthcare delivery, we need to establish safety standards and new models of care coordination. Next slide. These are our overarching research objectives: to characterize patient and provider factors influencing utilization of oral anti-cancer agents, to identify the structural, systemic, and psychosocial barriers to adherence, and to develop models and strategies to improve safe and effective delivery of oral anti-cancer agents so that clinical outcomes are optimized. Next slide. Here are some things to consider when you're planning your application. First, applicants are encouraged to focus on at least one of the following: a specific type of cancer, a class of drugs, or patients that are subject to health disparities. You can propose observational or descriptive studies or interventions. If you have an observational study, it should emphasize modifiable factors for future interventions. You can focus your study on either utilization, adherence, or healthcare delivery, or a combination of these. You don't need to study all three areas. And finally, we encourage you to contact your program director if you have questions about your study. Next slide, please. This slide lists our research priorities. Cross-disciplinary collaborations are strongly encouraged. And as I mentioned before, our main interest is in molecularly targeted oral therapy. Inclusion of medically underserved populations or groups subject to health disparities is not only a research priority of this NOSI, but an NCI priority as well. And finally, primary data collection is encouraged. Next slide. Now I'd like to address more specifically oral anti-cancer agent challenges in utilization, adherence, and healthcare delivery. With respect to utilization of targeted therapies, we need to understand how these medications are being prescribed in use. Some potential research questions are given here. For example, what are patient and provider characteristics associated with prescribing and use of targeted agents? And are there sociodemographic or health-related factors that affect utilization? Next slide. Adherence challenges involve understanding how cognitive, affective, and motivational processes influence adherence behavior. For example, how do patients perceive the risks associated with targeted therapy, and how do these risk perceptions influence adherence? And given the exorbitant cost of these oral agents, how do financial considerations influence adherence? Next slide. With respect to healthcare delivery, there's a need to understand how healthcare delivery systems are adapting to meet safety standards and the educational needs of patients and caregivers. For example, what are the system, healthcare, team, provider, and patient factors associated with the safe administration of oral agents? And what care delivery models enhance patient reporting of side effects and timely response from the clinical team? Next slide. Here's a list of funding opportunity announcements associated with this NOSI. And these funding opportunity announcements are also listed in the NOSI. Please pay attention to the specific requirements of the program announcement you're responding to. And this is very important, be sure to include the notice number of the NOSI in the appropriate field in your application. Next slide. Here is our contact information. And again, we encourage you to reach out to us with questions about your application. If you're not sure which of us to contact, you can always contact me, and my contact information is listed at the end of the NOSI. And as Bryce mentioned at the beginning of the webinar, a recording of the webinar and webinar slides will be available in about 2 weeks. Next slide. Now we'd like to spend the rest of the webinar answering your questions. And for this, I'll turn things over to my colleagues, Kate and Kelly.
Thanks, Wendy.
So my name is Wendy Filipski, and I will be reading the questions. Just a reminder, if you have questions, please type them in the chat box, and we can answer them. Kate?
Hi, good afternoon, everyone. I'm Kate Castro, and I am fellow program director with Kelly and Wendy, and I will be providing the answers to the questions along with my colleagues here this afternoon.
Okay, let's get started. Do applications need to target all 3 focus areas, utilization, adherence, and care delivery aims?
No, an application does not need to address all 3 of the areas. You can choose to focus on 1 of the areas or potentially 2, but really the main key here is just focus on that area that is of most interest to you and is most important to answering your research question.
Can you please clarify whether a proposal that was submitted to the previous program announcement would be considered a new submission or a resubmission for this NOSI?
As Wendy mentioned previously, there are 7 funding announcements that are listed in the NOSI. So it's very important that the applicant check the types of applications allowed in the section of the program announcement or the PAR to which they're submitting the application. That program announcement or PAR is the key thing to which you will guide you for what is required in your application. An example is one of the funding announcements, PAR 19039, only allows resubmissions from particular specific PARs. So again, very important to look back at the funding announcement you're going to be applying to and check what types of applications are allowed.
If I plan to request that my application be assigned to an institute other than NCI, can I submit my application through this NOSI?
NCI is the only institute that's participating on this NOSI. So if you submit an application through the NOSI, it will most likely be assigned to NCI.
Is an awaiting receipt of application, or ARA, required for budgets that exceed $500,000 direct costs in any of the grant years?
Yes. For budgets that are $500,000 or more in direct costs in any of the grant years, an ARA is required. And in our division, which is the Division of Cancer Control and Population Sciences, the ARA must be submitted at least 8 weeks prior to the grant submission date.
What study section will be reviewing applications to this NOSI?
These applications will be reviewed by standing study section within the Center for Scientific Review. And so CSR will determine the best fit for each application within our standing study sections.
Are new applicants who have not had prior NIH funding before encouraged to apply?
Absolutely. We welcome applications from new and early stage investigators. We do encourage you, if you are new to the NIH application process, to work with someone at your organization who has experience with the NIH grants process, and your business office can be a great resource for you as well. Additionally, we really encourage you to speak with the scientific contact listed on the funding announcement, and for the specifics to the NOSI, please reach out to any of us, Kelly, Wendy, or myself, specific to the area of your interest. And again, as Wendy said, if you aren't sure who to get in contact with, her contact information is on NOSI, so please reach out to her.
I didn't see receipts in the NOSI. When are applications due?
The NOSI directs applicants again to the 7 funding announcements that you can submit to. And so you need to follow the receipt date and the submission instructions in those FOAs. Also, just a reminder, in the grant application, there is a place where you can enter the NOSI number. Very important that you do that, so please make sure you include the NOSI number in your application.
Would an application be considered unresponsive if it does not focus on molecularly targeted therapy?
No, an application would not be unresponsive. It's an area of strong interest for us, but we would not say an application is not responsive if it wasn't specific to molecularly targeted therapies.
Does NCI consider studies evaluating policies and financial incentives already in place by CMS and other insurers to be intervention studies?
I would encourage you to look at the guidance that we have out regarding the specifics to economic research. There are some limitations on what can be studied within our grants. So I do encourage you to look at the current policy that's out and the guidance that's available for what can be done within economic and financial studies, and that will guide you better. And we will we can provide a link for that information when we send out the documentation from this webinar and the FAQs.
Will reviewers on the study section be instructed to note the emphasis on novel molecularly targeted agents?
So again, these grants will be reviewed at the study sections that are most appropriate that CSR assigns them to. So whether they will note that or not, we won't have control over. They will know of the NOSI, and whether they choose to do that as part of their review, that would be up to them.
Will we be notified by email that the webinar recording has been posted, or do we need to check on the website periodically?
For the webinar on our websites within the Division of Cancer Control and Population Science, we will update, like specifically I'm in the Healthcare Delivery Research Program, we'll notify you when that webinar is available. And I do believe the same would be true for the other programs. I'm not sure, Wendy or Kelly, if you have any specifics for your programs.
I know that the EGRP also has a communications email that will most likely be included in.
Same for me in the behavioral research program.
Are there any additional questions that we haven't covered? Does NCI consider health information technology as a strategy in responding to this NOSI?
I'll address this, and hopefully I'm answering your question correctly from the healthcare delivery side. So if you're looking at strategies where would doing something with health IT help in the care delivery setting and managing the patients and such, that would be a strategy, yes. And I don't know, Wendy, if you might have something specific to adherence in that.
Well, I think if you're using, let's say, mobile technology or text messaging to enhance adherence, that could be something that is definitely available, yes.
Any additional questions? So it looks like we don't have any additional questions coming in. I just want to remind everyone you're welcome to contact Wendy, Kate, or myself if you have questions. And again, this webinar will be published on the website. Oh, looks like we got one more. Are you interested in the development of prediction models for adherence?
Wendy, that
Yes,
would be best for you.
absolutely. Yes.
Are real-world evaluations encouraged, not interventions or clinical trials?
I'm not sure specifically what you might be speaking to there. Are in the center of thinking about like our pragmatic trials and things such as that? Yes, absolutely. Those are things we are very interested in. So it really would just depend. I would encourage you to reach out to one of us that is in the most specific area that you're interested in to talk to us a little bit more about what your considerations are there.
Will the slides also be available on the website?
Yes, the recording is available for anyone, and it will be uploaded, as Wendy said, within 2 weeks, along with the FAQ document.
Do we need to include patient outcomes? Adherence is more of a process measure.
So patient outcomes are not a requirement. It will really depend on what your research question is. So the outcome could be in the care delivery side. It could be something at the practice level or a multi-level. So a patient outcome is not required for the NOSI.
Is adjuvant endocrine therapy for breast cancer considered an oral anti-cancer agent?
Yes, it is. And we, in our previous program announcements, definitely had interest in this area, and this would be something that would be considered applicable for this current NOSI as well.
Okay, it looks like that's all of our questions. Turn it back over to Wendy.
Okay, well, thank you, everyone. If you have any more questions, please contact one of us, and we'll be happy to help you. And if you have any questions about your application or specific aims, please contact us. So thank you again for joining us.